Hi Tracy, how are you?
Good, thank you. So here we are again. So all about the Ozone Clinic, and this is Laura, and this is our third one. And today we are going to be talking about a new treatment. This is new service treatment that the Ozone Clinic are offering, and it is the IV ozone therapy. So, Laura, do you want to kick us off and just give us a little synopsis on what IV ozone therapy is, please?
Okay, so IV ozone therapy is another way of administering ozone into the body, but during this process we ozonate your blood and we get it into your bloodstream, which then circulate around the body and go systemically. Now we do this by drawing 200 mils of your blood in a sealed eye set, which we call the eye set, which is egg-shaped, and it is attached to the special machine that we use, and then we insert a needle into your vein and draw the blood up that way. We then ensure that we add an anticoagulant so that your blood doesn't coagulate, and then we infuse it with ozone. And we infuse this with ozone by agitating it, and then the blood gets infused totally with ozone in that 200 milliliters. We then put that back into your bloodstream under slight hyperbaric pressure, which the special machine that we use does. And so we can do this, that's called one pass, and we can do this up to 10 times. And we have about 5 litres of blood within our system. And if we do this 10 times, we then are ozonating up to about 2 litres of your blood. This then allows that to go into circulation and systemically and provide you with all the benefits that we're going to talk about.
Right. And just for the record, Laura, could you just say, you've used the word systemically a couple of times. Could you just clarify for those listening what that actually means, please?
So systemic is your whole system, the whole body system. So our blood is circulating our body and our whole body system throughout the day and throughout our life, and that when the blood goes back into circulation, it literally circulates around the whole body.
Great, thank you very much. So would you like to now tell us then, what are the benefits of having this IV ozone therapy?
So this is, as we work on a cellular level, this is basically getting ozone in at a cellular level by, what it does is as soon as it hits the blood, it produces things called ozonides, and that is a reaction that happens between all the different molecules that are in our body. The ozone basically, it donates an electron, which is a little bit scientific, but what that means is it's making a new molecule, and that new molecule is something that will be beneficial to the body. So it can be producing enzymes that will make antioxidants. It can be antibacterial, antifungal, antiparasitic, antiviral, and it's immune modulating. It basically works with the body for the benefit of the body, and hence it can help in so many ways because it's just benefiting what you need in your body on a personal level. So I mean, you can spend an absolute fortune trying to find out what's wrong with you, and don't get me wrong, I'm a big advocate of all the functional testing, but sometimes when we know what is wrong, and the treatment recommendations can be quite the same or similar, and that's where ozone therapy, which improves oxygen utilization, is such a great therapy, because it works on the whole body, and it can be used for really anything. So if I just go into oxygen utilization a little bit.
And also, sorry, Laura, I just wanted to just say as well, I think what's so amazing, and I know this is, this is so great about ozone, as you say, it works with the body, doesn't it? You know, and it's a natural entity that our body's used to anyway. So I think for those listening, I think that's a really key thing here, where we're not giving you anything that your body's not used to.
No, and it also, because it is a natural entity, and because it is working with the body, it's very safe. So there has been some major studies that have done across many clinics that have been using ozone therapy intravenously, and the side effects were very, very small, like 0.07%, which is unheard of.
Yeah, absolutely amazing. So, okay, Laura, sorry, I interrupted you. So, the benefits of having IV ozone therapy are?
So basically what it does is it improves, its main benefit is it improves oxygen utilization. And this happens in the mitochondria, which are part of our cell that makes our energy, and it's like our little powerhouse in each and every cell, and in each cell there can be thousands of mitochondria making energy for us, and we need this energy to perform every bodily activity. So without efficient oxygen utilization, our bodies won't function properly. We will get tired, brain fog, achy joints and muscles, you know, poor digestion, all of these common complaints that most people today are experiencing. So, I mean, so we know oxygen is our most critical nutrient, but it's not just what you take in and what you breathe, it's how you utilize it. And that's the difference between you at 20 and you at 70. It's the efficiency at which you utilize that oxygen. So the key to the treatment and the prevention of disease is optimal oxygen utilization. And decreased oxygen utilization can happen locally and systemically. So, you know, so when you've got an injury in a joint, that is where oxygen utilization has been decreased at a local level. But when we're getting things like diabetes, fatigue, our arteries are getting clogged up, and we're getting brain fog, all of those things are oxygen utilization at a systemic level. So that's where the IV therapy really, really helps. So if we think about people in their 80s, if they have oxygen potential, so good oxygen utilization, and that's oxygen utilization, you know, say of an average 35, 40-year-old, they won't get diabetes. They are very unlikely to have a heart attack. They were less likely to get sick because their cells are working optimally. And, you know, it is, you know, it's not a standalone treatment. It is a therapy within a holistic approach, you know, so we do obviously advise anti-inflammatory diet to go along with it, and other things depending on what your condition is or what your situation is. So basically, you know, what has changed? Why are we seeing so many more people that are needing to improve their oxygen utilization? Because the cells are not working efficiently and have basically decreased their ability to utilize oxygen efficiently. And this is because we're placing way more stresses on our body than ever before. And so what are stresses? They're anything that places a stress on the body. Processed foods, emotional stress, physical stress, pollution, cleaning materials make up the list is endless. The body burden is too much. So with IV ozone therapy, it improves the oxygen utilization and detoxification, because it can also bind to toxins in that process of making ozonides, which make them safe for elimination from the body.
Fantastic. So you can come along and IV ozone therapy, and as you explained, a certain amount of blood is taken, it's ozonated and put back into the system, and that's what is called a one pass. For some people, you might know this treatment as being called 10 pass. Okay. So Laura, can you just give us an insight? You know, what would one expect? You know, if I came along to you for the first time, would I straight away have a 10 pass, or what would you recommend?
No, we don't like to start with the 10 pass, because you can experience a detoxification, what's called a Herxheimer or a detox reaction, where you could feel nausea, sickness, headaches. If we dive straight into a 10 pass, you may not feel that, but for people with chronic conditions, they're more likely to have this detoxification, what's sometimes referred to as a healing crisis. And we don't want that to happen, because that indicates that we're recirculating toxins, which can do more damage, and we don't want to recirculate those toxins. So we want to build you up gently. So we'll start with a 3 pass, and firstly we'll do a consultation to see what is going on with you, and we'll spend some time discussing that to make sure that you are the right fit for IV ozone, and that is the right treatment for you. And then we will start gently with a 3 pass and build up to a 10 pass over time.
And like all these treatments, you can feel amazing benefits. We know some people feel amazing benefits straight away, even with a 3 or a 4 pass. But like everything, really, it's, you need to build it up, don't you? You need to kind of get your system used to it and have a sort of series of these sort of treatments to really, really benefit the body. Is that right?
Yeah, that's what we believe here at the Ozone Clinic, is that it is more beneficial to start low and build slowly, so that your body, we assess then how your body has behaved from one treatment to the next. And if you're feeling a lot of benefit from a 3 pass, we may continue on that 3 pass journey for a few more sessions to make sure that you're getting as much out of it as necessary, and we're not overburdening the body.
And we just had a question come in. How many sessions would you recommend on average to start with?
So most people most people don't feel any difference from their first couple of treatments, and so we do recommend that you have at least 3, and you will start to feel benefits between 3 and 5 sessions. And we recommend that a 10 session a weekly 10 sessions weekly.
10 weeks.
10 a week for 10 weeks is a really good place to start, because it is cumulative, and it will really help to get those cells full of oxygen, get the ozonides working so that they are helping that immune system, helping you to get oxygen throughout the body, removing toxins by binding to those toxins, and just basically cleaning up the body in a sense.
So can I just ask you, this, yes, it's great for people with chronic illness, autoimmune diseases, all sorts of things where elimination, obviously, and getting straight, as you say, systemic, boosting the body systemically. But actually, from what you're saying, we're all suffering from this sort of toxic overload. Then really anyone can benefit from, it's like maintenance, isn't it? It's good health kind of thing.
I mean, it is also a preventative tool. As I said, someone who has good oxygen utilization, and their cells are using that oxygen in the way they should, will be in better health, less likely to develop a chronic disease. So absolutely, to use it as a preventative tool is really the number one use, because we don't want to fall into a chronic disease state or imbalance. We want to stay healthy.
Great. And like every session that we've done, would you just like to share with those listening how they get in touch? Because they can get in touch with you, can't they? Just for a quick chat to start with.
So you can book a 15-minute free consultation by going to the website, www.theozoneclinic.co.uk, and booking that through the website. And they can also call to book an appointment on 01962 217 110. 0.
Brilliant. And also, we'd just like to remind everyone that you can follow us on Instagram, and also we are up there on YouTube, so you can rewatch these videos, and there will be lots more coming in the future. We're doing these about every other week at the moment, but you can also sign up to our newsletter. Do check out, as Laura said, our website. There's lots of information on there. And also, to tempt you, we are doing some sort of launch offers on the IV ozone therapies at the moment. So do go on the website and check those out as well. Laura, thank you so much. I mean, it's all so exciting. I mean, these treatments are amazing. I mean, I've had a 3-pass, I know, and I'm looking forward to my next one. It really does make you feel great, and you just know that you're doing something good for your body. If you're suffering or not suffering, it's just really, really important, isn't it?
Yeah, absolutely. It is truly a really wonderful treatment.
Yeah. So thank you, Laura, and we will be back in a couple of weeks.
Okay, thank you.
Thanks.
Bye-bye.
Bye.